treatments are completely unique. Each person gets an individually tailored programme. They get an oil blend that is for them. So somebody who has high blood pressure might use different oils. They might have a bad shoulder, but if they've got high blood pressure, there's certain oils that you wouldn't use and certain oils that are good for high blood pressure that you maybe wouldn't use on a client that also has a shoulder problem. So they're tailored. All the treatments are tailored. So the aromatherapy oils are blended. They're kept in a little bottle with your initials on. Nobody else gets to use it. And you can take it home if you want to. And use those oils at home. The muscular aches and pains would generally be treated with massage. I'd mix a blender according to your medical history, what oils would suit you, what ones that you like the smell of, and what ones have the properties that you need for healing muscular aches and pains. Some of them are warming oils that actually will do a really good job of helping the muscles. So I mix the blend up and then I would just massage the areas, well I do probably the whole body really, but the massage the areas that need treatment particularly. Sometimes you find knots in shoulders and necks, and I use different techniques to help release the knots and remove the tension in that area. Some stretching, and often I give you some exercises to do to strengthen or to stretch the muscles out to help you to treat yourself at home. So I have people that come in with an acute injury, a shoulder injury perhaps that isn't healing up very well, and the doctor's saying one thing and they're saying I don't want to do that. So they have a massage and they may come 2 or 3 times and then their muscle is working better, their joint is more in alignment, they're not in pain anymore, so I don't see them again until some time in the future, perhaps when they do something else. But then I also have people who like to come and keep their health maintained, so they come perhaps fortnightly. When people start, I say to them, come for every week if you can, for sort of a month or 2 months, and then drop down to fortnightly and monthly as and when, but also it does depend on what their budget entails and whether they can spare the time, so whatever suits them really. Most people see it as something that you can get in a spa, and where it is used just for relaxation, and they're quite surprised that I can find areas on their feet that are out of balance, and they can say, oh yes, well I had this injury or I had this problem, and that quite often shocks people. I can't say that I can cure or diagnose anything, but your own body has amazing healing powers, and it's kind of tapping into those to get your body to feel better about whatever's going on. So the theory of reflexology is that every area of your body and all your organs are reflected in different areas of the feet. If you put 2 feet together, that's the equivalent of your head. Your spine runs down the middle, so if your feet are together, it runs down the centre of your body. Underneath your toes are the sinus areas of your face, and you've got ears and eyes at that level there. These would be, and teeth on the other side. The lung area is just here, the diaphragm there, and it's basically the digestive system, your stomach and liver and gallbladder and pancreas are all in that area there. And the tops of your feet are the front of your body, your chest, and then you've got your hormonal systems here. Most people come in with some sort of stress-related condition. That would be probably the most common. I have a lot of people with anxiety or depression, and just generally feeling stressed out, can't cope with life, things are a bit too much for them. But I also have a lot of people coming with muscular aches and pains, joint pains, and several medical conditions such as IBS, which is stress related, or constipation, nice topic, and different issues that they're having with their health. Anything really, from an earache through to lots of people with coughs and colds at the moment, and some of the oils, the essential oils that I use are very good. They're traditional remedies like eucalyptus and menthol, just to help clear the airways, and sometimes we use that at the same time as doing a different treatment, so the whole room is filled with the smell of eucalyptus oil, but that helps people to breathe and can help them get over infectious or viral illnesses as well.